And of course, when you ask whether things are going to get better or worse, you can see anything about cuts is bad. And on all of these things, there is no majority of people saying it's going to make things better. People very divided, even in terms of what they know, which is not a lot, in terms of whether any of greater choice, abolishing PCTs, choosing a GP, any of these things is going to make things better or worse. The other thing, of course, we heard was the information revolution. I think I'll just skip through this very, very quickly. And that is that, you know, overall, people are very skeptical about data. Disraeli said there are lies, damn lies, and statistics. And one of the problems is even as we publish, or the government, or the PCT, or the commissioning body publishes performance data, a lot of people are very skeptical. 65% of us agree that you know, there are lies, damn lies, and statistics. And that means that we won't necessarily automatically believe us when we publish very detailed information. And the other challenge is simply that if you look at internet access, it's gone up another 1% since then. It's about 75%. But I think this chart should just remind us, if you're interested in access and engagement, one of the problems of the internet, brilliant though it is that people like me, the suits, I'm an AB, age 46 now, so I'm in the 45 to 54 category. You can see somebody like me, where are we? Here we go. 84%, no, 97% of people like me have got it. If you look at the difference between the overall population, or young ABs, my son, and elderly pensioners, there's this vast gap. And the idea that clever people in Whitehall who are all used to using this and all their friends use it and think it's normal, we are just a bit delusional sometimes. It is not like that in large parts of our communities, and we need to think about that. Frontline staff, more control of their work environment. We're going to empower people in the NHS. It sounds good. Doctors and nurses are saintly, so let's have a look. We know, and I think this is one of the challenges, that when we crunch through the numbers for DH in terms of what makes people feel comfortable about where the NHS is going, believing that the NHS is being well run, one of the strongest drivers overall is actually having a good time when you go and get some treatment, and that wasn't always the case. Before we got waiting times down, it was actually just your views of the government. It didn't even, because the NHS, of course, doesn't exist. It's something we talk about, but of course you don't use the NHS. You go to St Mary's, you go to, I don't know, Guy's, you go to, you know, Jimmy's or somewhere like that. You go to see Mr. Patel or Dr. Patel. You don't go to the NHS. And so, you know, feeling good about things, feeling safe, but very strong negative factors, staff slagging things off, newspaper coverage, perceptions of mismanagement, all of those things, and of course, are going to be real challenges. So if you want people to feel good about things locally, what would we say? And I think, to be honest, I would go on saying the same things that I've been saying for some time. Patients, what is a good service now in the NHS in 2011 is not different than what it was in 2008, if you're a patient, or in 2005. Maybe a little bit around the edges, but overall, expectations don't move that quickly. So, you know, we've crunched through all of the numbers. If I was running an acute trust, I would be making sure those 5 things, you can download the report, get those things right. It has to be beautifully clean. It has to be, and not only does it have to be beautifully clean, it has to look clean. Remember, cleaning in common parts, in the corridors, at the busiest time of day. Not at night, very, very high-vis jackets, very, very, you know, it's the same with British Airways. When we ask people whether they think British Airways planes are safe, they judge them on how clean they are. There is actually a correlation between MRSA rates and perceptions of cleanliness. The public aren't completely deranged, but it would be very, very clean, and we'd have a lot of stuff around communications. Remembering there is no, and particularly clinicians and others, communicating clearly and effectively, explaining things, giving people dignity and respect. How we define that varies depending on who you are. Notice no reference whatsoever to money. There is no correlation between how much you spend and how happy your patients are when we look at individual trusts. And there is also no correlation between how likely you are to kill the patients and how happy the patients are. I mean, there may be some extremes with Tunbridge and Malling and a few places like that, but overall, Stafford, but overall, generally, there are lots and lots of places where they're much more likely to kill you and the patients are just as happy as everywhere else. And so it's, you know, it is really about these things. So just about perception, again, not reality, but, you know, if they feel good about things, they'll feel better. So it's those things, and, you know, you can crunch through them in different ways. They explain most of the satisfaction. And interestingly, when we're looking at what drives innovation in the NHS, and I think Jeff, who's speaking after me from currently of the Young Foundation about, I don't know if he's taken over as head of the National Endowment for Science, Technology and the Arts, but a piece of work we've just done for them asked people in both local government and the NHS what was driving innovation. And interestingly, it wasn't competition at the bottom, it was actually what people using the service were saying. Seeing those people on the streets, eyeball to eyeball, talking about services. And bizarrely and interestingly, when we did a piece of work for Gordon Brown when he was Chancellor of the Exchequer, about a decade ago, looking at how one drives, what are the motivators for improved delivery and reform right across the public service. One of the things that we got back from the front line, it was not this sense of competition or we'll go bust and they'll all go to St Mungo's or to United Healthcare or something like that. They would do things differently, try new things if they believed it was better for the people they could see in front of them. And so that must be one key challenge that we have to communicate. And of course, somehow we don't always do these things. And I think, again, a piece of work we did for the National Audit Office a few years ago was just worth reminding ourselves of some of the barriers. Things that get in the way. What locks the door to change? And I'm not sure how much those things are going to change in the near term. It's just interesting that one of the groups that we found were most, in some ways, risk-averse, and possibly correctly so in a service that is all about saving life, were actually managers and clinicians in the NHS compared to some other public services. This sort of quote sums it up, actually. In health, innovations must be properly piloted. Rapid change is not always a good idea. Ideas need to be communicated and discussed with similar specialists and conclusions reached. So there you go. Don't do things too quickly. Generally we can see, if we look at big change programs that the NHS has done in the past, take something like NP Fit. We found that everybody thought NP Fit, whether you're a doctor, a nurse, an IT manager, it will be a good thing. It will improve care in the NHS. Then we look at actually how involved people felt they were. If we're looking back at that the whites of the eyes thing, what does the data show? This is, do you feel you owned it? What have we got? To what extent were you involved in rolling it out? The IT managers, yes. Anybody who might actually use it, no. Result, disaster. And as we embark on one of the largest reform programs we've ever seen, we might well bear that in mind, particularly at a local level. So all I would say finally, I think, is just it's going to be, if you're in a sort of leadership or management role, it's going to be interesting. Now is the change. Never let a good crisis go to waste, says President Obama. And we are now going to generate some of ours for you to play with. In a sense, you could say that we have this sort of perfect mixture of massive reform, real funding challenges, the fact that we're going to have 36,000 people over 100 by 2017, it's going up from around 9,000 a year or so ago. We're, possibly slightly more demanding, complex, and, the media and generally people getting better and better at making a noise. Your patients will be talking about you on Twitter, or at least some of them will be, and, you certainly need to keep looking out for that sort of thing because things are changing very, very rapidly.